Hello everyone. Now I'm going to discuss about one bad case story. 1 week back, we had a delivery. The delivery process was uneventful. I was the resuscitating person. I delivered the baby. The baby cried immediately after the birth. Then I discharged the baby after 2 days of delivery, and I reviewed after 1 week. During that time also the child was doing extremely well. Child had started to gain weight, feeding well. The next day I had a call from emergency department. I rushed to the emergency department. I saw the baby was unresponsive to pain, very feeble pulse, saturation and BP was not recordable, heart rate is less than 60. Then I started CPR by securing airway, putting line, giving bolus. Child has had started to respond. Our resuscitation. Child has started to move limbs and heart rate pick up. Doing resuscitation as the responsible of a physician to rule out the cause for this event. But unfortunately, I am not able to address the reason for this event by examination. Many of time, what most probably reason for this kind of event may be a cardiac problem or respiratory problem, lung problem or a brain problem. During the session, I ausculted, there is no murmur, there is no rhythm change in heart. After securing airway, the air entry was good. For brain port, anterior frontally was normal. Uh, so we do next step of investigation. I did a chest X-ray to rule out any aspiration, but the chest X-ray showed there is no signs of aspiration in the X-ray, and some cardiac causes can be addressed by just X-ray. There is no cardiac cause, but from that X-rays, then I had strong suspicion of some kind of intracranial bleed. So I did a CT. The CT shows there is a big bleed over the posterior fossa. As the bleed in posterior fossa, there is no anterior frontally bulging. This bleed compressed the brainstem and cause the respiratory arrest. This will be the most probably cause. We have to double clarify whether the respiratory um, arrest might be due to uh, bleeding or cardiac arrest will cause bleeding. I have to clarify that because either can happen anyway. Uh, but in this case, most probably cause will be the bleeding happen fast, then lead to the cardiac arrest. How we conclude those things by asking mother. We put a question many questions. Mother confirmed that the child had some kind of seizure activity before 2 hours of the event, and that clearly says the bleeding happened fast, then followed by cardiac arrest happened, because cardiac arrest per se will cause intracranial bleeding because of increased PaCO2 and increased lactate level. Uh, then we need to address why this bleed happen for the healthy child. For that, multiple reasons will be there. Most commonly, intracranial bleed are due to vitamin K deficiency. I gave the vitamin K injection, but sometimes after giving vitamin K injection, also babies might have this kind of problem. But we did a blood test to rule out the such thing. PTNR was simply normal, uh, but APTT was prolonged. Sometime aneurysm in brain maybe that was measured during the antenatal scan. In this case, we did CT angio also, but there is no aneurysm. The APTT was alone prolonged. For that, we send a genetic test. The genetic test showed hemophilia A. Most of time hemophilia present little later, but some case we have this kind of presentation early as well. But unfortunately the blade compressed the brainstem. We could not able to save the baby. We Then why we did genetic test? Because of counseling for other as hemophilia is a genetic disorder. Um, have to do the genetic counseling for that parents for next baby. Thank you.